Good morning. I'm Dr. Julie Kilgore. I'm here with one of my patients, Rusty.
Good morning.
Good morning. We're going to talk a little bit about his experience so far after bariatric surgery. He's now 6 weeks after sleeve gastrectomy. Why don't you show our audience a picture? You took this picture the day you started your liquid diet. Is that correct?
Yes, ma'am.
Okay. And I don't know if you can zoom in on that. Give our audience a good picture of that. And he was just telling me before we started that he was thinking, tell me what you're saying about your daughter, and she was reminding you how far you come. And
I have to remember because I see myself every day. I don't notice the changes as much as others. So I was saying, I said, I really don't notice that much. She said, you're kidding me. And she pulled the picture out. She said, look at this. This is the difference.
Yeah. It's kind of like watching your children grow. You forget how much they've grown until your parents come in town and they only see them every few months or whatnot. They're like, you're so big. And it's the same way in reverse. You really just start to drop those pounds. Tell our audience, when you started thinking about bariatric surgery, what are some of the key points or your thought process that actually got you to our office? How did you come to this decision?
I have struggled with my weight a lot of my life, and I have tried all the diets, the different change your lifestyle, and nothing seemed to work.
Right.
And then we discovered there were some medical conditions involved as well. And I came to the realization that the only way I was going to be able to get any more of this off was to move forward with this surgery. And that's when I came and met with you, and we had the long discussion about why and what all I had tried. And I was working out. I'm still working. I haven't been working out since the surgery because I can't. But I was working out and trying to do all the right things, but it just wasn't working.
Right. And we talk a little bit about, actually our first consultation, we go over a lot of things, but I think one thing that's really important is expectations and what to expect after surgery. If you're empowered and really know what you're getting into, what it's going to take, it helps you to be in the right mindset to really succeed. And I think that's where I can really compliment you, because you have really committed yourself to this and obviously seen results after just 6 weeks. You're doing really well. So I guess talk a little bit to our audience about going into surgery with the right mindset.
I think for me, I had to, just like anything else, if I go to a specialist for something, I have to go with the idea that I'm going to you for a reason, and I have to be willing to follow those guidelines. And I really had to make up my mind that no matter what I was going to, no matter what, I had to do whatever it was going to take, because this is about my life and me living better and being more healthy. And so, excuse me, I had to make up my mind. Whatever I was told to do, that's what I'm going to do for however long it takes. I know the liquid diet, some people struggle with that, and I know some struggle with the soft food diet. And there were times, I'm going to be honest, that I was like, I was like, no, this is a mental thing.
Right.
This is a mental thing. And you have to have the willpower to recognize that and say, no, I'm going to follow this.
Tell me, you had emailed me a little while back, and you're stressing about something. Tell me a little bit about that.
We just had our appointment like a week before that, and I'd gone on the soft food and soft food diet, and my weight loss had plateaued. Up to then, it was steadily dropping, and it plateaued, and I wasn't worried. It's okay. And then after about a week, my concern was, am I doing something wrong?
Right.
It wasn't so much that I'm not losing and I'm afraid it's not going to work. It was more of, do I need to change something in what I'm doing? And that was my concern. So I emailed you, and you were so sweet. You said, nope, stick with it. And now it's started to kind of move a little bit again.
Exactly. And I think it's important for patients to realize you're not going to lose weight like a gentle sloping downward hill. You're really going to lose it like stair steps. It's just kind of how our body works. You're going to plateau, you're going to drop, you're going to plateau, and you're going to drop. And a couple things to make sure you're doing during this weight loss process is A, make sure you're getting adequate calories, because if you're not, your body's really going to kind of go into starvation mode, hold on to all those calories, and you actually won't lose weight during that time like you should. The other thing is to make sure you're getting in adequate protein. It's really important. Talk to us a little bit about what's been the hardest thing for you during this whole process.
That's a good question. I'm trying to think about. I think initially the liquid diet before surgery
Right.
was the hardest part. Once the surgery was over, and you and I had discussed this,
Right.
I found that I wasn't hungry, so I had to remind myself to drink my shakes or whatever.
Right.
But before the surgery, with having that large stomach,
Yeah.
I had I drank a lot of liquid to try to keep myself to feel full, and I think that was the biggest struggle for me.
And I often tell patients it is so much easier on the flip side, because when I take out that stomach with this sleeve gastrectomy, I'm taking out that part of the stomach that makes the hormone ghrelin. That's what tells you you're hungry. So a sleeve gastrectomy is often a lot like just taking a permanent diet pill. I mean, there is no pill, it's just the consequence of surgery, and I think that helps a lot.
It does.
If you were to give our audience just some feedback for the people that are considering bariatric surgery, what would you tell them?
Make sure, and especially from my side, make sure that before you do the surgery, you deal with the issue, any issues or things that contribute to eating too much or so forth. I dealt with several issues from being raised by my parents that they didn't know any better, and then from being in the Army and being taught to eat really, really fast.
Right.
So I had to, before the surgery, I worked on getting those fixed. And I worked on eating slowly, putting my fork down, taking a bite, putting my fork down, enjoying that bite, conversing with people at the table.
Right.
I make my daughter, sometimes she gets a little frustrated, because I make her sit at the table with me to discuss her day while we eat, because then I eat slower.
Right.
And that helps me.
And actually, just a little side note, but studies show that eating with your children, there are so many benefits to that. Having conversation, those children have higher grades, are more well-balanced, and just simply do better in life. So just another reason to sit down at the table, eat slowly, and enjoy your food.